Hello, and thank you for joining us for another exciting educational topic in cardiac rehab. Today, we're going to talk about cholesterol. First of all, I would like for you to understand what cholesterol is, the breakdown of cholesterol, what is considered to be normal, and then we'll talk a little bit about how to control cholesterol. So cholesterol is a substance that is produced by your body in the liver. The liver does manufacture it and sends it out to the rest of the body, where it is used to make cell membranes. It helps aid in digestion. It also helps convert vitamin D in the skin and develop some hormones. Cholesterol is made of two special proteins called high-density lipoproteins and low-density lipoproteins, along with some fats that are called triglycerides. Your cholesterol score is a measurement of those three things. The HDL are the good type of cholesterol. They do help remove the bad type from the insides of your artery and in the bloodstream. So a higher HDL level is better, and it helps improve your overall score. So an HDL level, we love to see those at least 60 or higher. The low-density lipoproteins, or the LDL, they are the bad type of cholesterol. So that's what we really want to control. When you have a high LDL, that's the type of cholesterol that does stick to the insides of the arteries and begin to cause those blockages that could lead to decreased blood flow to your heart muscle. So we definitely want to keep the LDL controlled. An LDL level should be 70 or less to help maintain and control those blockages. Triglycerides, that's actually a form of fat that's packaged with the cholesterol when the lipoproteins form in the liver cells in your body. The triglyceride levels, we would like for those to be less than 150. Triglycerides are stored in the fat all over the body and can be used as an energy source, sort of like carbohydrates. A triglyceride score higher than normal could mean that you're at a higher chance of developing coronary artery disease. So the total cholesterol score, how that is calculated, is here at the bottom, and that shows you that the HDL plus the LDL plus 20% of the triglycerides, that gives you the total cholesterol score. Now, moving on to how you can improve your cholesterol score and make yourself healthier and your arteries healthier. So most heart and blood vessel disease is caused by a buildup of cholesterol, plaque, and some other fatty deposits in the arterial walls. The arteries are what feed your heart. So if they become clogged, the blood flow to your heart is reduced, and that could cause a blockage, causing you to have chest pain or angina. If a blood clot forms on top of that blockage and causes the artery to completely close off, then that could cause a heart attack. If the blockage was in an artery that led to your brain, then that could be a stroke. So this could be, as you could see, could be a very serious condition. So we do want to control that. There are some lifestyle changes that you can make to help improve your cholesterol. You can eat a heart-healthy diet. You could maintain a healthy weight, be physically active, like you're already doing if you're in cardiac rehab. And if you were a smoker, it would be very important to stop smoking. Smoking does tend to cause some hardening inside of the arteries, and that makes it easier for the cholesterol to stick to. So we do encourage you to stop smoking, and of course if you need help with that, please ask us, and we'd be glad to connect you with someone who can help you with that. Some people need to take a medicine to lower their cholesterol levels, and actually most heart patients are on a cholesterol medicine, and that is just to make sure that we're keeping that cholesterol level low so that you don't develop any other blockages in any other areas, and to keep you healthy as long as we possibly can. your healthcare provider will set up a plan to improve your cholesterol that likely will consist of medications, as we mentioned, and a heart-healthy diet. Now, some folks need a little help with some suggestions about what a heart-healthy diet is, and there are some within this educational information. So foods that you want to focus on are fruits and vegetables. The foods that are low in saturated and trans fats, and fruits and vegetables are a perfect example of that. You also would like to get a variety of whole grain foods like whole grain bread, cereal, pasta, brown rice. It's a good idea to replace your pasta and rice with a whole grain version of that. And it's very tasty and enjoyable. So I encourage that change for you. At least half of the servings should be whole grains. A fat-free 1% or a low-fat milk product options are also very good to keeping cholesterol low. When you choose a meat, some changes to the meat product could help as well, like taking the skin off of poultry and choosing meats that are lean. Cuts of meat that are labeled loin or round usually have less fat, so those are good choices. Eating a fatty type of fish such as salmon, trout, or tuna and sardines are good choices as well. They have been shown to help reduce the cholesterol levels as well. Also, unsalted nuts, seeds, and dried beans and peas are very, very healthy for you, so those are a good thing to have each day. They're very good to snack on and they're quick to grab and eat. And when you're choosing oils to use, oils like canola, corn, olive, and safflower flower oils are good choices. Also important is knowing what to have to limit or not to have too much of. So, of course, sodium. Extra sodium is not healthy for you. It can cause problems such as high blood pressure and other things. You want to avoid having too much sweets and sugar-sweetened beverages, red meats and fatty meats that are not trimmed. That adds extra fat into your diet. You don't want to have meats that have been processed with a lot of sodium because that adds to how much sodium you're getting each day. Limit full-fat dairy products. That can add some extra, of course, fat into your body. Baked goods with saturated and transaturated fats like donuts, cakes, and cookies they add up and can cause some health problems if you eat too many of those. Occasional is okay, though. Look for words on the food labels like hydrogenated oils and avoid too much of that. Saturated fats like coconut oil, and palm kernel oil, we do recommend that you avoid or limit. And of course, solid fats like shortening, stick margarine, and lard, we do recommend that you do not take in much of that. And fried foods, of course, limit the amount of those that you take in. This last page shows a picture of some foods that are healthy for you. Foods that have a lot of color, fruits and vegetables, of course, are very good for you. So we want you to have a variety of fruits and vegetables in all of your meals. Be careful when you bake, broil, roast poultries and meats, and you want to always use a rack so that the fat that comes out of that meat as it's cooking will drain off of that product. So looking for leaner cuts to help you choose the right kinds of meats. Don't baste with drippings. Instead, you want to be careful with those and just use the natural products. Broil and grill instead of pan frying if possible. Cut off any visible fat on the meat before cooking. remove the skin from poultry pieces, and that'll help eliminate some fat. Use a vegetable oil spray to brown or saute foods. And remember to limit the portion size of any higher calorie foods, and limit sodium by using low sodium options and using low fat instead of regular cheeses. And those are some suggestions to help make your meals healthier. Now, of course, Renee, our dietitian, will speak to you and determine your specific likes and dislikes and help you make some choices that are more specific to you. So,
my name is Gabrielle, and I'm an exercise specialist with Cardiac Rehab, and today's educational topic is high blood pressure. So what is high blood pressure? According to the American Heart Association, high blood pressure is when the force of blood flowing through your blood vessels is consistently too high. High blood pressure usually has no symptoms, so it is very important that you get your blood pressure checked regularly by your healthcare provider. Also, if you have the opportunity to do so, it is very beneficial to purchase a blood pressure monitor for at home so you can check your blood pressure daily. Some symptoms that seem to be indicative of high blood pressure include severe headache, confusion, fatigue, irregular heartbeat, and chest pain. So some quick facts. 1 in 3 American adults have high blood pressure. High blood pressure oftentimes creates other health risks. These risks include, but are not limited to, stroke, heart attack, heart failure, and in some cases, organ damage. An example of that would be kidney failure. Some individual risk factors that can increase your chances of having high blood pressure include age, sex, ethnicity, alcohol and tobacco use, and also a sedentary lifestyle. 69% of people who have their first heart attack have high blood pressure, and 77% of the people who have their first stroke have high blood pressure. So knowing your numbers. It's very important that you understand the difference between the systolic and the diastolic blood pressure. So the systolic represents how pressure is exerted when blood is ejected into the arteries, and the diastolic represents pressure blood exerts within arteries between heartbeats. These numbers do tend to fluctuate, and your blood pressure at rest can be different from your blood pressure after exercise or during periods where you are under great stress. It is important that you pay attention to these numbers that you receive. This chart here presents a great visual to understanding what is considered normal and abnormal. So for a normal blood pressure, you will have a systolic less than 120 and a diastolic less than 80. So we're going to pay great attention to the and or the or. In the elevated category, you will have a systolic between 120 and 129 and also a diastolic less than 80. So at the elevated stage, it's a great time to speak with your primary care physician to discuss ways to lower your blood pressure before reaching the hypertensive stage. Also, so we have hypertension stage 1 and stage 2. Hypertension stage 1, you have a systolic of 130 through 139, or you have a diastolic of 80 through 89. Hypertension stage 2, we have a systolic of 140 or greater, or we have a diastolic of 90 or greater. In these stages, your doctors will advise lifestyle changes and possibly prescribe medications. They will take into consideration other health risks that you have, and each plan will be individualized and tailored to that patient. In the hypertensive crisis, we have a systolic of 180 or greater, and or we have a diastolic of 120 or greater. It is very important in this stage that you seek medical attention. If after multiple attempts your blood pressure is still 180 over 120, please call your doctor. If you have someone available, have them take you to urgent care or the emergency room. If no one is available, call 911 for EMS to transport you. It is very important that you do not drive yourself. However, it is very important that you seek medical attention. So don't drive yourself. If no one is available, call for EMS. So how to control your blood pressure. You should make it your goal every day to control your blood pressure. You can control your blood pressure by doing the things listed here, and also by completing cardiac rehab, you increase your chances of lowering your blood pressure. This is why we oftentimes stress the importance of doing the work necessary in cardiac rehab. This is one of the benefits of that, lowering your blood pressure. Additionally, you can control your blood pressure by taking your medications as prescribed and at the same time every day. You can manage your stress, cutting back on caffeine, and also working closely with your doctor helps control that blood pressure. Controlling your blood pressure is very beneficial. Taking control and working to regulate your blood pressure can reduce your risk for heart attack, heart failure, cardiac death, and also stroke. Your doctor is your greatest resource to help you manage and control your blood pressure. The American Heart Association and CDC also provide great information and handouts to help educate you on high blood pressure and ways you can control it. In brief, remember that it is up to you to do the work to control your blood pressure and eliminate that risk factor of high blood pressure. Never be afraid to ask for help, but you must make it a lifelong commitment. If you do have any questions, please feel free to contact your primary care physician or your cardiologist. Have a great day.